Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer at Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave.
Well,
Good morning, all.
Yeah, this is going to be interesting today. This is a topic I don't believe we've touched on yet. We're going to talk about adrenal fatigue. That sounds rather fancy.
Yeah. So it is something that I've kind of come about, Dave, in the last, 6-9 months thereabouts. Always working on that growth myself and identifying areas where, what else can we do to help our guests, our patients, get to a point where they feel like they're making progress with their health. And this is a big one, something that a lot of practitioners are not really well versed in, and it can be an absolute game changer for folks. And it's treating the adrenal glands, and so kind of the guy that had a lot of research on it, his name was Hans Selye, and my friend Dr. Schallenberger down in Nevada is very well versed in this treatment, and he's been doing it probably over the last 25, 30 years or so. And but it is something that it just in the last few months that I've started to incorporate into my care plan for folks. It's been an incredible game changer. And so who doesn't come in to see me that, and this is the majority of folks. Now, I do have some folks that come in and say, hey, I'm feeling pretty good. I just want to don't want to go on prevention. I want to optimize my health. And I love seeing those folks, but I get a lot of folks, too, that come in saying, I'm dog-tired. I can barely get through my day. I need caffeine to get me through the day. I've got to take a nap. I feel less viable than I did 5-10 years ago, and I don't like the course I'm on. I've got brain fog, inflammation, pain, and we get going. But, this little piece, in fact, had a gentleman in yesterday that just had an incredible, this is, again, I am so blessed we are here at the Okoboji Wellness Clinic and the team to get to work with folks that come in and are tired of spinning their wheels. And he flat out told me, though, he's like, I wasn't so sure. He's like, I was hopeful that we'd make some progress, but I wasn't so sure. He's like, I've tried so many things, been to so many doctors, and I just, but he's like, get me on. I want to do some testimonials and share my story. So he will be on in coming weeks. He's excited to share his story because it's one thing me talking about it. It's another thing when you get to hear it from him. And but he came in and he's in his late 40s and had just low energy and horrible afternoon fatigue, brain fog, decreased physical stamina, felt like he was losing muscle tone, just generalized malaise, achiness. He just felt older than his age. And we always are looking, like we talk about it, identifying the weak links in the biologic system and try to identify anything that is really stressing the body. So we did that with him, and in a matter of 2 to 3 months, he did some dietary changes that we suggested, and we got him on some certain supplements and a couple traditional prescriptions, one of which was hydrocortisone. And hydrocortisone, a lot of folks will get a little bit nervous about it because they think it's a steroid or it's prednisone, which is commonly used when we get an acute back pain flare, or if we've got an asthma exacerbation, or we've got some allergies we're treating. But the problem with prednisone, you can't be on it long term without consequences because it decreases your immune system, and it also can decrease your bone mineral density. Hydrocortisone, on the other hand, is naturally produced by your adrenal glands, which are kind of by the kidneys. And over time, Dave, because we live in a day and age where it's life in the fast lane all the time, and we've got constant stressors coming our way. And this Hans Selye, what he did a really sophisticated experiment, but not so sophisticated, but effective. He put mice into ice water and saw and timed, he and his associate, how long the mouse would stay afloat before it'd start to go under. And different mice would have different lengths where they'd stay afloat longer. What he noticed is the adrenal glands enlarged, they hypertrophied the longer that they were exposed to stress. They're trying to compensate and make more and more hormone to deal with the stress. Eventually, however, that gland, that organ, the adrenal, starts to give out, and it stops producing that hormone. And so that's the state where I see a lot of folks that come into the clinic that they've been in such a high state of stress, inflammation, pain, brain fog, all the things, not sleeping at night, and these things just kind of get going and they ramp up speed, and you get to a point where their adrenal gland is toast. A lot of times they'll come in and say, I've got reactive hypoglycemia, I can't keep my sugars up, or when I stand up I get dizzy. There's a lot of different things that I look at to say, but most of the time, if you're in my clinic and you've got any form of chronic condition going on, doing some adrenal support can be an absolute game changer. And so it was for this individual. Of course, we did more than just that. And this is where we talk. Sometimes I'm a bridge, and I do some traditional stuff, some traditional treatments, and this is a prescription. However, I like to do things that are similar to what your body already makes. So hydrocortisone, for instance, your body already makes that. So what I'm doing is prescribing that to a certain individual. It's giving the body what it is missing or not making enough of anymore. But of course, as always, we want to get to root cause and identify, well, what is it that's causing that stress on that adrenal gland? So that's part of the mission. It's like, well, is it mold? Is it some food? Is it some other toxin that's stressing? Is it just a high stress life? And is it no sleep at night? If you don't address the stress side of it, what's triggering the stress on the adrenal gland, many times folks are going to need that chronic support through prescription. However, if you can identify what it is that's stressing that adrenal gland, is it an allergy, like an environmental allergy, for instance? If you can address it and remove it, then that adrenal gland is one of the few glands or organs that actually can kind of come back and respond and work again. There's not too many that do something like that. So anyway, in this gentleman's case, he came back yesterday and just smiling from ear to ear and saying, "I've got my life back. I'm back to coaching, Little League." All my friends and wife are just like, "What are you doing? Because you look like a whole different person now." And that was part of the equation for him. Certainly not in and of itself, all by itself. Other interesting thing, we always kind of touch on the gluten aspect. And for many people, gluten can be inflammatory. He cut that out, and that was another game changer for him. But hydrocortisone, it's many times when we see folks with lack of energy, we think thyroid. It's interesting because those two kind of coincide together. So many times if you've got low thyroid, folks aren't also checking for low adrenals at the same time. So you need both for both to function well together. The other huge thing we always talk about, Dave, is metabolism. How well is your body making energy, or ATP? If your adrenals are low and you're not making hydrocortisone very well, guess what? Your metabolism is suffering. So you're going to have lower energy. And what is one of the biggest areas that utilizes hydrocortisone? The brain. So those are the folks that, if the metabolism's not going very well because you don't have enough hydrocortisone, those are the folks that come in and say, oh, I just got this brain fog, I'm having trouble with focus. And so we just start peeling away at the layers, and in this individual case, he's getting his life back, and it's an exciting thing to be a part of.
Yeah. Wow, that is such a cool story. Adrenal fatigue and what might stress the adrenal gland, and the stressors on it can be environmental, but it can be just plain stress. I've been doing a lot of research the past couple of years, and these doctors like yourself that have looked to peel back the layers of the onion: sleep, stress, diet, exercise. These things are huge.
Absolutely, and that's the thing. We offer a lot of different approaches to speed up the process for the healing, but sometimes it's not adding always another modality or treatment like hyperbarics or ozone therapy or neurofeedback. It's taking something away. And what is it that we might be taking away? We're trying to take away what's inflaming the body. So as we work to try to identify what's inflaming the body, take that away, and then you add some simple things to support the body in that healing process. Recently, this last spring here, I'd had a couple that really wanted to focus in on just lifestyle changes and a few supplements and dietary changes. And I did some ozone injections in the joints, and boy, oh boy, that individual yesterday came into me, and this is after about 2 to 3 months of seeing me, and said, the way I'm feeling now, I wouldn't even have come in to see you the way I'm feeling now, because I'm feeling so good. And that was just after some ozone shots in the knee for horrible knee pain, and can get to the barn and run with her grandchild now, and some things where there was some skepticism at first with them and making some of these dietary changes. They did, and a couple of these different supplement recommendations that optimize metabolism and energy production, oxygenation. And we didn't even have to yet go into the things that I love to use so much, the tools like the ozone and the hyperbaric therapy and so on and so forth. So it is possible to make big changes for folks and feeling better, but a lot of times you just need our team to kind of help organize a plan for you, because it can be overwhelming. You see all these supplements online, a lot of health influencers online, and it gets confusing, and you kind of say, well, that sounds good, and that sounds good. I'm going to pull that. I'm going to try that. But putting it into something that makes sense and that works for you, the individual, that piece sometimes gets missing. So folks are well-intentioned. They're out there trying to fix themselves and solve the problem, and they just haven't been able to kind of put all the pieces together yet. So that's what we're here for, to help identify that path and make that path more clear for you.
And we talk about it all the time. We want people to absolutely get better, but we want people to be able to live the day, not just survive the day.
Absolutely. So it's making that journey through life every day. I talk about trying to focus on the moment that you're in every day, and making that the best moment, and to do that, to be in that space and feel good about it, you have to feel well. So we don't want to just survive. We want to thrive every moment.
Absolutely. All right.
Absolutely.
How can folks come see you?
Yeah, 712-339-6024. You can do a discovery call with me that's complimentary for about 15 minutes, and talk a little bit about what we're about, and making sure we're a good fit for a journey together. And then we can get you scheduled, and we will sit down typically for that first visit. It's about an hour long. And we are at 3305 Berkwist Avenue in Spirit Lake, Iowa, just off of Highway 71. So we got an amazing team here, and a lot of great things are happening. So we want you to be a part of the journey with us, and look forward to you setting foot in the space here. And it's a beautiful journey to get started. And I always encourage folks just why not you, and why not now? Let's get feeling better.
Absolutely. Why not you? All right, Dr. Meyer, thank you so much. Have a great, great day, and we'll chat again next Wednesday.
Beautiful. Be well, everyone. Thank you.
Thank you. Dr. Bradley Meyer with us this morning from Okoboji Wellness Clinic. You can also find out more at okobojiwellnessclinic.com.